Hello and welcome to the latest episode of the YouTube channel. Now in this episode I'm going to be talking about the importance of prehab prior to an ACL reconstruction. Now it absolutely boils my piss how little information and support people are given prior to ACL surgery. We know for most people it's going to be a 12, 18, 24 month process. It's going to be one of the most challenging things you do physically and mentally of your life. And we know that going into the surgery fit and strong is going to put you in a much better position and actually help you recover quicker and regain that strength. So it really annoys me that people are left on a waiting list for 6, 12, 18 months sometimes and just given little information or support. And people are often nervous and scared about what to do in case they do more damage. And that can really set them back, and they then have an even more difficult surgery. And often I think people regret having it because then the support after it is just as bad. I know there are some people that do get some support. That for the most part tends to be in a kind of group class environment, which is obviously better than nothing. It teaches about kind of strengthening the main muscle groups, but I still think there's a big gap that needs bridging from turning up to a kind of generic group class where everybody's doing the same thing versus understanding what you can do away from the gym from a kind of strength and conditioning point of view to really optimize that recovery. And I think the missing piece is being target driven. Most people don't have a criteria or target to hit, and that can cause them to be demotivated. They feel like they're just going through the motions and turning up to the gym and just not really engaged in the process. Whereas if you're target driven, you know what you're working towards, that can make it a lot more purposeful. Now, I know having a specific date and target to work to makes a big difference for people. I find that people, when they have a date, you can really focus and reverse engineer that process. When people are on a long waiting list, the kind of heads away from thinking about the ACL surgery, which is understandable to a degree. But sometimes you can get the surgery within a week or so. So it's really important that you're preparing yourself and going to the gym, even if it is feeling a bit repetitive and boring, because you certainly won't regret the kind of outcome that you will get from doing that. Now, I see this firsthand with the people that I work with. The ones that have trained in the gym before the surgery tend to recover a lot quicker and are more in line with the current the kind of recommended guidelines and timelines for progression. Whereas the ones that have gone into surgery, deconditioned, unfit, not really done much work, it tends to take them a lot longer. It's not always the case. It's multifactorial, but as a general rule, people that go into surgery fitter, stronger, come out the other side a lot better. And that's exactly what I did. So I trained as hard as I could prior to the surgery. Essentially, the goal was to get as fit and as strong as possible, trying to grow as big a muscle mass as possible in my legs. And I found that after the surgery, my recovery was much better, just hit all the criteria much quicker. So I regained my extension. We know that's one of the big things that we need to hit early on. I regained extension in 5 days and got a heel pop after 8 days, an active heel pop, which is way ahead of the curve. But I truly believe that was because I got my quads ridiculously strong. So when I had the trauma to the knee, the impact from the surgery, so because my strength was up here, it dropped to here, it was a lot easier rather than being down here and dropping to here. It's just a lot easier to get the quads working and get walking normally after the surgery. Now, obviously, depending on how long you are now until your surgery is going to determine how much you can get out of the prehab. Now, prehab isn't as straightforward for everybody. It depends on the type of injury you've had. So if there's been a lot of trauma like fractures or bucket handle meniscus tears, a meniscus root tear that need more urgent surgery, then you might not be able to train in the way I'm about to describe. So that's fine. This isn't a blanket rule for everybody. Although I have had clients that were on a waiting list for surgery. We were training in the gym. There wasn't really any issues, just a bit of mild pain, got themselves stronger, had the ACL surgery, and then there was a meniscus root tear. So that's not necessarily a reason that you should not train. It's all depending on the person and the symptoms you're experiencing. But there may be some people that if you have a locked knee or you can't straighten your knee, then you're certainly not going to be able to load the knee up heavy. And that's just unfortunate. That's where obviously you should then have the surgery on a more urgent basis, which doesn't always happen. So it's still important to understand what you need to hit and see if you can at least try and work towards those, and it might just be a much slower process for you. So if we look at the general recommendations for going into surgery, we want an 80% symmetry between leg strength, We want ideally full extension. We want a normal walking gait without a limp, and we want a calm, quiet knee. So these should be the absolute minimum standards you should be hitting. Now, I think they're definitely underserving people, particularly in the UK, who are on long waiting lists, and you should be aiming for much higher. So the goals that I recommend for people are hitting 150% of your body weight on a leg press for a 1 rep max conversion, 50% on a leg extension, 30% on a hamstring curl, at least 25 heel raises, 20 hamstring bridges, and at least 20 sit to stand. So that's going to look at your muscle strength and muscle capacity. And if you can achieve those targets, then you're certainly going to be in a much better position than if you didn't do anything. So it's really important to set yourself a program up that is going to work on those muscle groups and understand what it actually takes to achieve that, and understand how to train properly. Like I say, if you're not too experienced with training and pushing yourself, it's a much better opportunity now while you're potentially pain free and you've not had a tendon cut out of you or major knee surgery and a lot of pain, to then learn and understand how to train properly after that when you naturally have more pain. So again, these are minimum standards. I'm going to talk you through the standards that I hit, which obviously served me quite well coming out the other side of surgery. So looking back at my surgery, I was 78 kilograms at the time, and on the leg press as a 5 rep max conversion to a predicted 1 rep max, I was lifting 199 kg on the leg press, which converted to 255% of my body weight. So that's above the recommended 150%. Return to sport is a minimum of 180%, so I was above return to sport levels. My leg extension was 103% and 97% of my body weight. Return to sport, depending on what your sport is going to be anywhere between 70 and 100% recommended. My recommendation at minimum is 50%, so I was almost double the 50% recommendation. My hamstring curl, I was 52% body weight. Return to sport is 40 to 50%. Heel raises, I was 30 on each leg. Recommendation for return to sport is 25 plus. Glute hamstring bridge, I was 32 and 31. And return to sport, ideally over 25. Sit to stand, I was 35 plus on both legs, so I could have gone on for more, but I stopped at 35. And return to sport standard is 25. Side bridge endurance test was 90 seconds on each side. Return to sport, ideally we want over 60 seconds. I've not mentioned that one in the one previously. So that's a side bridge, is essentially assessing your core endurance strength. We know that lateral instability in the trunk muscles can be a risk factor for injuring your ACL. Single leg balance, I could hit target 45 seconds. And 23 and 20 seconds with my eyes closed. So my nervous system and balance was working well. And then I also did some jump tests. So this is what I do with some of the guys I work with. I was 51.8% on the app that I was measuring it with. Prior to my surgery, my highest was 58, but I did injure my knee in April, so a few months before my surgery, which set me back a little bit. My drop jump reactive strength was 2.64. That was down from 3.07, and that's how reactive you are off the ground. So again, we can measure that through an app, or if you've got access to force plates, even better. And that was the main thing. So I was working on my strength, my power, my reactive strength, because I got to a point where I was pain free. Now, at a minimum, you obviously want to be just trying to build the biggest, strong muscles possible, but if you can get back into jumping and power work, even better, because again, the higher baseline power and reactive strength is, the less of an impact it's going to have. So if you can work on everything and you've got that time and opportunity, perfect. So I had my stage 1 revision surgery in November 24. So I essentially had 7, 8, 9 months to prepare for that, with a setback in April, which meant I couldn't jump for a couple of months. That still put me in a good position. So I was always training in the gym in that period, trying to keep those numbers as high as possible, so that, like I say, I was fit, I was strong going into the surgery. So ideally, you want to be going into surgery feeling fit, strong, and really questioning whether you actually need it because your knee feels that good. Now, we have an ACL reconstruction to stabilise the knee in dynamic tasks, so it's not going to show up when you do strength training for the most part, controlled jumping activities. So we still might need an ACL reconstruction to stabilise the knee so you can play sport, but general day-to-day activity, if it's absolutely fine, perfect, that is a great position to be in, rather than still being in pain, still hobbling around, still not having confidence in your knee. We can still build confidence in the knee despite the fact that you've got no ACL, but there might just be that ceiling where you can't get back to changing direction quick or playing sport, obviously. So if you've watched this episode and you've realised you've not really been doing much and you may be a bit nervous about the state that you're going into surgery, then it's really important that you at least invest in getting that help, whether it's the local physio that specialises in ACLs that can give you some targets, even a personal trainer in the gym that can just help you get generally strong. They might not know much about ACLs, but if you're pain-free and your goal is to get stronger, then maybe speaking with a local personal trainer might be an option for you. I help people across the country, internationally as well now. So I do all my work online. I can support people with online training and programming. And I'm working with a couple of people now that are preparing for surgery that have recognised the importance of going in strong because they didn't feel right and they knew they needed to prep properly. And they're making great gains, and I expect them to come out the other side, assuming there's no complications, much better and progressing through the recovery as we would expect. So if you are lacking support, I can't emphasise enough how important it is to get that support. Obviously, you can DM me on Instagram at rickwilliams_ACL coach. If there's any questions, then leave a message in the comments, hit the subscribe button. I appreciate all the support that I can get, and I'll see you on the next episode.